10 weeks after the first reported case of the novel coronavirus in the state of New York, we are seeing parts of the state planning to reopen this Friday. Not New York City, of course, still the hardest hit part of the country, but the northern part of the state and the central part of the state, which were not quite by any means as hard hit as New York City. We're going to see reopening of manufacturing, curbside retail, and construction. Now, employees will have to maintain social distancing, wear masks, and as well engage in sanitizing the workspace. Local officials will be given the power to give the green light to businesses to reopen. They're also going to be given the power to decide what safety precautions have to be instituted, and they can also decide to shut down those businesses if we see the number of cases tick up at any point. Now, that is phase one. Now, phase two will start to see real estate, professional services, and finance opening. Phase three will be restaurants, bars, and hotels, and the final phase will be large-scale gatherings, movie theaters, Broadway theaters, as well as schools. So a new disorder has been named for this. It's called pediatric multisystem inflammatory syndrome, and it has similarities to Kawasaki disease in that you'll see rashes, you'll see nausea, as well as headaches. But on top of that, a lot of the young patients that are coming into the hospitals also have toxic shock syndrome. So we're seeing a lower blood pressure, an elevated heart rate, and because of that, a lot of those young people are having to go into the ICU, and medical professionals are saying that it is more dangerous than Kawasaki disease. Now, 3 deaths in the state have been associated with this, and 2 more are under investigation. But overall, we're seeing more than 90 children that have been hospitalized with these kinds of symptoms. Now, doctors say there is effective treatment, but it is critical that patients get to the hospital quickly. The state's governor says its health department is teaming up with the CDC to basically track, identify, and respond to the new syndrome to help more children across the United States get the protection that they need.